Hi, so welcome to Bedford Chiropractic Clinic. I'm so pleased that you've chosen us for your healthcare and for your chiropractic experience. And I so look forward to looking after you and helping you achieve your optimum goal of health. Because all I'm here to do is to help you find out what's causing the main issue that is giving you your symptoms, to help you resolve that permanently, and to help you then get to what is your ideal goal of what health should look like. And that will start today. And I'm so looking forward to taking that journey with you. So welcome to our clinic. So what's going to happen now is that Emma is going to look after you. She's going to get you to fill a medical questionnaire form in if you haven't already. And then once that questionnaire form is filled in, I will get started with you, take you through that medical questionnaire form, get as much information as I need to make some decisions. Is chiropractic the right thing for you? Are you going to be best served by chiropractic treatment? If the answers are yes, we'll go ahead and do a full examination, and then we really will find out what is giving you your symptoms. And by showing you that and then discussing with you what the treatment plan is, we can then make some decisions and we can get started today. So let me just quickly show you around so that you know where everything is. So firstly, obviously, you came through the front door. If you need the toilet is just outside there on your left as you come out. Follow me and I'll just show you down here. Okay, we're so proud to have you come and visit us. Now, the treatment room here, and this will be our consultation room right there, and we'll be taking you through all of that in a moment. So, welcome to Bedford Chiropractic Clinic. It's an absolute pleasure to be looking after you and getting you started and taking you through your journey. Welcome.
Right, I'm John Walker. I'm 84. Been given to chiropractor for 40 odd years. I think it must be 20 years with Surinder. And we usually come about every 3 months, unless we've got a major problem, which we rarely have. We look after our diet, exercise, and that's why we're here still, hopefully.
Well, I'm here. My role in life, I think, is to look after each other. Our diet and what goes into our system, a good healthy walking, swimming, climbing mountains if we've got the opportunity, and all's well. I have more problems than John over the years, but Surinder and myself have worked through it, and we're still here, walking about, getting up in the morning, etc.
John, demonstration.
Touching my toes. Touching my toes. Can you see him touching?
Wow! And John, just sorry to ask again, but how old are you, John?
84.
84. Amazing. Guys, long, healthy life.
Thank you very much.
Thank you. So what message would you give to sort of the older generation?
Look after yourself and let Surinder help you look after yourself.
Well, you didn't need to say that, but thank you very much. I appreciate that. And Susan, it isn't just about chiropractic, is it? What else is it?
No. It's food is very, very important. I'm not saying you mustn't have cake or anything like that, but a little bit of what you fancy every so often does you good.
Absolutely. Thank you, both of you. You're an inspiration. God bless.
My name's James Rutter. I've had sciatica for 5 to 6 years. I've had physio in the past, which hasn't really worked for me. I've been recommended to come to Bedford Chiropractor. Couldn't put my shoes and socks on at first. Had 3 treatments now so far, and everything's going well so far. I'm on the road to recovery with all the help from Surinder and myself doing the stretches at home. So a long path to recovery coming up.
I've been having back pains, back issues for a good few months now. Went to Bed's Chiropractor, and trust me, it helped me a lot. Dr Sandhu's been really good, and they've got an offer coming up, so definitely go and check it out.
I came to see Dr Sandhu about 3 or 4 years ago because I was aware my posture was not very good and I was getting some neck pain. I was thrilled with what he did for me, and then I suggested that my husband come as well, but he was a bit unsure, but I had to talk him into it. And now we've been coming for 3 or 4 years, and we come regularly just to keep ourselves mobile. And for me, the money I spend on coming to Dr Sandhu is far better than spending it on a holiday. And you can tell.
Well, yes, I got talked into it, but I'm pleased I was, because I feel fine, I feel great. And if I do get aches and pains, then Dr Sandhu sorts me out very quickly. And I understand there's an offer on at the moment, so check it out.
Hello, I'm with Dr Sandhu at Bedford Chiropractic Clinic, and just like to give an update on how much I've benefited from treatment within this practice. 2 injuries, one when I was 17 on the base of my back, the coccyx, a second injury just in the small of my back, and one between my shoulders, all before I was 20. I had injections, I had physiotherapy, I had chiropractor work done. I'm now 68, so that was 49 years ago or thereabouts, and during that period I have suffered unmercifully and still worked fully, continued through, but could not find anybody who I felt could give me any assistance, any help, until my daughter came to this practice for similar needs with her back and invited me to come along with her, and 1 session with these fine people here and I could see the instant improvement. I'm now probably 4 months down the line. The last session that brought me in, I was getting shooting pains up and down the back, and I honestly thought I was going to end up hospitalised this time. Came in, and now, very short space of time, the job has worked, and I am now feeling the best 50 years on basically that I've ever felt. I do the exercises that I'm told will help, and I definitely can feel that they do assist and help. So it's not just about what work that is done on the day, it's the ongoing that is required, and that is why I have faith, because these people have told me honestly from the start, and their work has proved it. One satisfied person. Please don't hesitate if you have issues similar to me. Thank you.
Okay, go ahead.
I come in from my lower back. I was on very high painkillers. We've been stretched out. He is, what is it called?
Adjustments?
Had all the adjustments, been explained with how our posture, how to fix our posture, put it upright, and to put the soles in our shoes, and I feel amazing.
Brand new, yeah?
Walking in here, I was like this.
Yeah, literally.
And I can move. I couldn't pick up my son for the last couple of days. I feel amazing.
Driving already. Yeah.
I couldn't recommend it to the highest. I really couldn't.
Literally, 100%.
I didn't believe, but I'm now a believer.
Now a believer,
I've
firm believer,
been putting it off for years.
Yeah, definitely.
Thanks, babe.
Hi, my name's Steph. I'm a qualified nurse. I've been suffering from back pain, neck pain and sciatica down my leg for many years now. I finally got it in me to come to the chiropractor, and it's the best decision I've ever made. I was living in a back brace, which I now no longer wear at all, and I'm so less reliant on all the painkillers that the GP gave me, and I couldn't recommend more. If you've got any pain at all, come see the doctor. Best decision I've ever made.
Hey there. So for many years I've had awful back pain. I was struggling to even get out of bed in the morning. What to speak of walking around and sitting for prolonged periods. So I finally decided to come and see Bedford Chiropractic Clinic with Dr Sandhu. I can honestly say it just changed my life. Like, I can't tell you emphasize how much it feels so good to be pain-free and have my mobility back. I understand they've got an amazing offer coming up, so I'd really suggest if you've got any lower back pain or any pains within your body, you come and check them out. Thanks a lot.
Hi, my name's Tom. I recently pulled my back out really bad at the gym. I had to go to Bedford Hospital for an ultrasound. The pain was unbearable. I was on crutches. They gave me a load of painkillers, three lots, and came home, and the pain was still awful. I was still having to use the crutches. I called Surinder. He was back from his holiday at the time. Came into his practice. Within 10 minutes, I was up, walking around with no pain at all. Brought my little sister for the first time. She was amazed, and couldn't recommend this guy enough. And I know they've got a special offer at the moment, so definitely check him out if you're interested. Could not recommend him enough.
I have been in pain for so long, and various doctors, going to one doctor to another doctor, trying to solve the problem out, but always, they give you the medication or the time off, not to go to work or stay at home. Nothing helped. Been to osteopath, been to physiotherapist. Osteopath helped because they found out, it was, injury on my lumbar joint. That was 17 years ago. Then, nothing happened for a long time until 2 years ago. I did suffer with a bad menopause, and inflict, lots of other problems with my health. But, the biggest problem, it happened, 2 years ago when I woke up one morning with a severe pain in my right leg, a cramp, that, shot it from the top of my leg, down, to my right leg, left me in pain, and where the cramp was, left me tender, and that pain never went. Soon after that, a few months later, I woke up, with a bad pain. I couldn't get out of bed, so I didn't know what it was. Doctors, they said it was sciatica, so they were treating me for sciatica. They didn't look, other things, other issues, what happened. So straight away, they gave me tablets, musculoskeletal again, physiotherapy, same old story, tablets, physiotherapy, nothing helped. I've been referred to a doctor, surgeon in Luton and Dunstable Hospital with results from MRI scan, because I insisted, for that MRI scan. If I didn't insist, they would have not let me to have it. So, they found out, what is the problem. So they were talking about injections, so to inject, or, if that doesn't help, doctor said, maybe surgery, but, surgery is not good, I know that can cripple you for life. So my pain was getting worse and worse and worse, day after day until, it became so unbearable. And, for the last 2 weeks, I could not cope anymore with the pain. And this is my son, who is coming in here. I didn't know the place, I asked him, can you tell me where did you go, Alex? And he told me, and I made an appointment. I came here straight away. Today I made an appointment this morning, and here I am with the doctor. And I can't believe, the problems that, I have, to hear. I knew that I have the problems, but, the problems are so severe that it's going to take a little while until they become, better. And I trust in the doctor that, he'll put things right. I straight away feel better now. I haven't been able to stand for that long like I'm standing now. I needed to sit down. But with the first treatment, I can say, that, I'm so happy, and I'm looking forward, for the future treatment, and get my life back in order and my body shape, to become in the normal way like it was when I was born.
Hi there. I came today to Dr. Surinder because I was experiencing pain in my upper back, neck, and I had this problem with my wrist for like 10 years already, and it was really affecting me while exercising. So I said I will give it a try. After today's session, I learned that posture is very important, and what kind of like soles you wear for your shoes, it really helps with pain, because everything starts with the way you walk and the way you stand, and it affects your back. So I've been having a treatment today, and I can say that my wrist feels so much better, and my back and the movement in my neck is incredible. I've even been able to do a push-up, which is very good for me. And I've been giving some advice to do some exercises for posture, and that's gonna help me with my back pain, and I'm looking forward for more treatments. Yeah.
Hello there. I was really hesitant coming here today. Actually, she brought me here. It's my first time at a chiropractor. I already feel much better. My neck feels lighter, my back feels a bit lighter as well. I'm looking forward to do some more treatments. I have had a problem with my elbow, and Dr. Surinder already done some kind of treatment for it. It already feels lighter and doesn't feel that much of a pain anymore. So yeah, I learned some basics actually about posture and about exercises that could help lift stress from the back. Yeah, and I'm really happy of choosing Dr. Surinder.
Yeah.
Okay, so what is chiropractic suitable for? Good question. Surinder Sandhu, Dr. Chiropractic from Bedford Chiropractic Clinic. So chiropractic is suitable for everybody. I know that sounds a bit coy, but Arnold Schwarzenegger said that chiropractic should be used by everybody all the time. When he was training, he saw chiropractor every day. Now why? Because he understood that the brain sits in this amazing structure right in here. 7 hours after conception, this begins to form. Your brain and your nervous system begin to form. And it goes on to control absolutely every muscle, tissue, cell, organ in your body. Now, if that connection from the brain to the body, organ, muscle is not working, then something is going to be wrong. And that is when you will get a symptom. So as a chiropractor, my job is to find that. And now we treat newborn babies, because you imagine a baby being born, it's very forceful on the spine. Also our oldest patient is 98 years old. So from baby to 98 years old, we treat everybody. We are here to help you. What we will do is we will find out where the cause is and go from there. So the treatment is suitable for you. Check us out on Facebook, check us out on Instagram, check out our YouTube videos, learn more, and I look forward to helping you. So what does chiropractic treat? Well, for me personally, I treat pretty much the whole body. I treat any foot problems, any ankle problems, any knee problems, any hip problems, any pelvic SI joint problems, and of course, every single part of your spine. So low back problems, any rib or mid-thoracic problems, and obviously any neck or shoulder problems. And any headaches at all, and also to do with your elbows, your wrists, your hands, your fingers. So every single part of your body I can treat, because over the 20 years that I've been in practice, I have done so many courses and learned so many different ways of examining you and analysing you and obviously adjusting and treating you. So why don't you just come and have a look? Come and have the consultation and let me see how I can help you, because there's lots of ways that I can possibly help you. Because as a nutritionist as well, I can give you some advice on that, exercise as well. Because my job is to empower you to be in the best health you possibly can be. Follow us on Instagram, follow us on Facebook, check out all our YouTube videos, and I look forward to seeing you. Will an adjustment hurt? Surinder Sandhu, Dr. Chiropractic from Bedford Chiropractic Clinic. Now, very good question and a common question that we get asked. Now, I cannot categorically say that it's not going to hurt, because what's happened is is that you have come with a subluxation where the joint is jammed up, and this part of the nerve, the pain part of the nerve, is now firing up, and it's inflamed, it's aggravated, and absolutely there's pain in there. So when I adjust you, when I get that joint moving again, yes, there is going to be a little bit of an ache there, right? It's a bit like going to, you know, when you've gone to the gym for the first time and you've had a workout, you may feel like that afterwards. But what you will feel is you will feel a release of endorphins, and there will be some pain relief. Majority of the time, there is some immediate pain relief. The whole idea then is for you to continue working on it and to keep moving, doing some gentle exercises, and also using ice to also relieve that as well. But I can absolutely categorically assure you that you continue with the treatment, and then we can absolutely get more movement in there, reduce the inflammation, and get you pain-free again. Check out our videos on YouTube, check out sort of our Instagram and Facebook, follow us, share this video with everyone. Any comments, questions, down below. So what is the subluxation? Surinder Sandhu here, Dr. Chiropractic from Bedford Chiropractic Clinic. So what is subluxation? Now, subluxation is a term, in chiropractic terms, it means when a joint is locked up on another joint, there is a misalignment. This is what we are sort of basically using to explain when a joint locks up on another joint. That is what we call in chiropractic language as subluxation. So my job is to get that joint moving, because what can be happening is the nerve here coming from the joint can now be irritated, and 20% of the nerve controls the muscle, 70% is basically the physiology, the organs, but 10% is the pain. And when that 10% of the nerve is aggravated, irritated, inflamed, that's when you feel the pain. So by releasing the joint, getting that joint moving, getting it aligned, getting it lubricating again, then we're going to fix that problem. All right, so that's what a subluxation is, when a joint is out of alignment. Watch us on Facebook, follow us on Instagram, and watch our YouTube videos, and I look forward to seeing you soon. Surinder Sandhu. So what is an adjustment? Surinder Sandhu here, Dr. Chiropractic from Bedford Chiropractic Clinic. So what is an adjustment? Well, this is your wonderful spine, and what we look for, what I look for as a chiropractor, is I look for where the joint is misaligned, where it's subluxated. Once I find that subluxation, I need to get that joint moving properly again, because the reason for getting that joint moving properly is so that I can get the nerve to fire properly, because when it does, then it's going to work. It's going to sort of make a connection with that muscle or cell or organ, and it's going to help it to work properly. So what I'll do is I will go in there and I will locate it, and either using my hands or using an activator, I will basically put a very, very fast stretch through that joint, through that muscle. What that will do then is that will allow the joint to relax. It will reduce the inflammation. It will improve the movement back in the joint, and it will sort of obviously give you pain relief as well. So that is what an adjustment is. An adjustment is a very, very controlled sort of movement of the joint that is not moving properly, so that it gets full function and you get the reduced inflammation and pain relief. Check out our website, check out sort of our YouTube channels for more information, follow us on Facebook and Instagram, and I look forward to seeing you and helping you. So what does the manipulation mean? Surinder Sandhu here, Dr. Chiropractic from Bedford Chiropractic Clinic. Now, what is manipulation? Well, a manipulation is just a term. It can be called an adjustment. It can be called sort of a mobilization. And all those terms, all they refer to is that when I have found joint that is stiff, a joint that is misaligned, not moving properly, well, that's what's giving you some symptoms. So what I need to do is I need to find it, locate it, and then we need to get it moving. We need to get that joint mobilized. So that's all it is the adjustment will do that. Now, I'll either use an activator, which is really gentle, or I may use my hands, or I may use a drop, what's known as a drop, because the tables that we have in the clinic allow me to do that as well. So there's several ways of doing it, depending on what I think would be the best way to mobilize or adjust that joint for you. The whole idea of doing that is to get you that full range of movement back in that joint, reduce the inflammation, and get you pain-free range of movement again. So I look forward to seeing you. Check out us on Facebook, Instagram, check out our YouTube videos, share this video with friends and family members, and I look forward to seeing you and helping you soon. You take care. Okay, I'm glad you're here at Bedford Chiropractic Clinic. Now, I believe you come see Matthew for a massage, yeah?
Yes.
Okay, I hope you don't mind me saying, I just saw you sort of sitting there, and I just want to show you something, okay? So I want you just to look at me, because I'm just going to do what you've just done, okay? So, firstly, okay, now look at me from the side. Okay, what do you notice?
I know what you're going to say. It's bad posture.
It's a bad posture, yeah? But, you know, you're not on your own. Everybody seems to be doing this, yeah? But let me show you a way that we can improve that. So if we just put it up here, put our elbows into here, and put our head back. Because every time we move our head forward, the head in a man weighs about 14 to 18 pounds, in a woman about 12 to 14 pounds. So you can imagine if that weight is here, the body can cope with that because it's designed to do that. But as we move our head forwards, away from our shoulders, we're now creating stress here and also in our low back as well, because the head now feels much heavier to these muscles. So the more we can keep our head in a neutral position, the better. And obviously, if we have the phone up here, then it's easier to read as well. It's better for our neck. But also importantly, right, your arms are going to get tired after a while, so you've got to have a break, a natural break, right, which is a good thing to do. Yeah, so please try and be aware of that. Now, the other thing that we notice, right, is that you're crossing your legs. Right now, I know that it seems to be the most comfortable thing to do, but actually it's not really good for our spines. And if I just show you, I just exaggerated a little bit. If I do this and I'm doing that, now can you see what I'm doing to my spine?
You're twisting.
I'm twisting it, exactly. And then obviously if I put my sort of knee down, I'm now sort of stressing the joint here and I'm stressing the hip as well. Now as an exercise, as a stretch, it's a good thing to do, you know, to stretch like that. But you only do it for like about 20 to 30 seconds. But to do it just as a way of relaxing in a chair for any length of time, not a good idea. Yeah. So we want to sort of sit like this, and obviously here at Bedford Chiropractic Clinic, we have these tools here that are these little pads that you can sit on, and the whole idea of sitting on those is that you're wriggling. And as you're wriggling, you're actually working the core muscles and making them stronger. And shoulders back, head up, and then you can obviously sort of do what you need to do, which unfortunately is the bane of our lives, is the mobile phone.
I first came to Bedford Chiropractors because I had real bad pain across my upper back.
I had really bad lower back pain and my mum suggested to come to Bedford Chiropractic Clinic.
I've had back problems for many years since I foolishly moved some paving slabs in the garden.
I came to the clinic because I was suffering from just back pain and neck pain and knee pain.
But the main one that I want to talk about was back pain that I first had about 3 years ago, and it came from absolutely nowhere.
I went to the doctors and they didn't help, so I thought I'd better come here on a recommendation.
So I did the traditional thing, went to the doctors and was told that to get a prescription for strong painkillers.
I have to take a maximum of 9 tablets daily, 2,700 milligrams. I knew it was really affecting me, but I had no choice because there was constant pain. Since I've started coming to chiropractor clinic in Bedford, I must say it's going into 2 weeks now. I've not had one single tablet and I couldn't feel any better.
And I've been feeling so much better. I've been coming since May, 2 sessions a week.
So we've been probably about a month, 5 weeks into it. Quite intensive, 2-3 times a week, and there's some stretches and exercises, doing the proper things rather than the stuff that's probably hurt me over time.
And then when I found Dr Sandhu, my life changed. My back is now quite flexible and I'm enjoying things a lot more.
In a week, my back pain had been sorted out.
I feel so much better. I've had, I think, about 9 sessions now, 10 sessions, and the improvement has been incredible.
The response I've had has been amazing. Feel a lot looser, more posture's got so much better. When I turned up, I was really arched forward.
I still can't believe it's like a miracle. I'm only halfway through my treatment and I'm already feeling almost there.
It's now October, so I'm a lot more pain-free, walking a lot straighter. I can feel myself driving straighter. So I definitely recommend booking in if you haven't already.
I'm a lot less pain, I'm more mobile, I can play with my children more, which is the most important thing. Less pain, sleep better.
So what I'm saying essentially is I've been coming here for 10 years. I trust him and he is very good. He seems to know what to do and how to do it to make people healthy.
And I recommend people come into the chiropractic clinic because certainly it works.
So I highly recommend them. They're absolutely brilliant.
Hi there, Dr. Sandhu here from Bedford Chiropractic Clinic, and I'm here with my lovely patient Chiro. And Chiro asked a question that I'm sure a lot of patients have in their minds, and I'm sure you do as well, and it was to do with sort of the neck. So Chiro, what was your question?
Why is it that your neck clicks?
Very good question. So why is it that the neck clicks, and what is it that a chiropractor is actually doing with the neck to make it feel better? So the neck is 7 joints. We call them vertebrae, 7 joints, and these joints are designed to move in a specific way. The alignment of the joints allows them to slide forwards, glide forwards, and also to move that way, and also the top few joints there will allow sort of the rotation, which is the normal range of movement of the neck. But what can happen is, because of sort of the way that we live our lives, through sort of emotional stress, physical stress, the way you sleep, the way we hold our head far too forward, the way that we sort of perhaps did something, an exercise movement, could be a myriad of things. And what that creates is it creates a stiffness in a joint. Now, when that joint is stiff, then what's going to happen is the muscles around the joints are going to tighten up to try and protect it. And that's where a stiffness will occur. Now, that stiffness will probably stay with you for quite a while unless you actually sort of do something about it. But even if you don't feel stiff, it doesn't mean that the joint has regained its full range of movement. Now, when you sort of are turning your neck and it's clicking, what's actually happening is that when this particular joint here, say for example, is stiff, the ones above and below are now having to take the stress, take the strain. So they're having to do a bit more work. And over a period of time, they'll get a bit looser, but the joint that is stuck stays stuck. So what you're actually hearing is you're hearing the clicking of the joints and the ligaments that are now stretching sort of in the loose joint. So that's what the clicking is. It's the clicking of the loose joint that's occurring. Because when a joint gaps, that's when a click occurs. But the joint that's stuck is still stuck. So the reason that you feel good after a chiropractic treatment, right, is because what we as chiropractors do is we look for the joint that's stiff. And then what we do is, in my case, I use an activator, right, which is a specialized chiropractic adjusting tool, which has had 60 years of development. So it's very gentle, and basically I find the stiff joint, then over your skin and your muscles, I will basically put a very, very shallow but fast thrust through that area. And by sending that vibrational frequency into the muscle, I'll allow that joint to move. And what that will then do is it will move the one that's stuck, not the ones that are loose. So now you're going to regain your full movement back into your neck. And that's why after the adjustment, your neck feels so much freer, so much looser, and it feels nice. Yeah? Now, you had a second question, and that's also a question which I think is important, and that was related to headaches. Now, headaches can have a myriad of reasons as to why they occur. There is a biomechanical reason as well why headaches occur, and in my experience over 25 years and through a lot of research that's been done as well, right, what they have found is that when this top part of the cervical spine, C1 and C2, are locked up, it can cause headaches. It can cause headaches. And certainly, sort of in my experience over the 25 years that I've been treating thousands of patients, what I have found is that when a patient comes in with a headache, if I get these joints released and get them moving again, generally the headache will dissipate. The headache can also be caused by referred pain from these muscles here as well, where these muscles are tight, because again, through posture, through the way you've sat, the way you lay down, the way you've slept, and that then can give you what's known as like a referred pain into the head, which can feel like a headache as well. So as a chiropractor, I will be looking for any kind of stiffness and tension in those areas, and then obviously I'll do what's known as an adjustment, using sort of, in my case, my activator to release that tension and thereby relieve the headaches. And of course, you know, there's other things that you as a patient can do to help yourself, which is of course do the exercises, which are all available on my website, bedford-chiropractor.co.uk. I've got an exercise video there, which is generally for the whole body. So it covers everything from neck down to your feet, how to sort of exercise and move. And everybody should have a look and have a go at them, because they will help you. They will help you. And then of course it's drinking more water and lots of other things you can do. And there'll be some follow-up videos on headaches sort of later on on this channel. Shirley, thank you so much. I really appreciate you asking that question, and thank you also for allowing me to sort of just share that information with my patients as well, because they're both questions that get asked. So thank you for that. I hope you found that useful. If you did, then you know where we are, Bedford Chiropractic Clinic, Dr. Sandhu, with my lovely patient Shirley, and thank you so much, and look forward to seeing you. If you ever need us, just give us a call. Bye for now.
Okay, my name's AD Gunn. I came here, oh no, the dates are gone, on last week, I should basically say. It's only been a week so far, I think, altogether, me actually being here. But I came in here with my neck, couldn't turn my neck to the right, to the left, up, down, anywhere without pain. But at the moment now, I can turn my neck always with no pain, which I still don't understand. I've had pain in my back, basically my limbs, knees, because I've had damage to my knees, and I haven't been able to stand without pain or move without pain. But I've had a few things done to me here, and I can move, still feeling, but not the pain I've been feeling for 8 years. So it's a big difference to me in the last, like I say, it's only been just in my third, I think it might be my third actual session here. And that's all that's happened to me so far. I'm amazed to see what else comes next, because I have got a lot of pain going in all different places on myself. But today I've had a big difference. I came in here with pain in my neck, going down my back, and I have not got pain right now. So kind of a bit confused, but I really don't know. I'm just a bit confused, because it's hard being in pain for years, and in not even a week, you're not in pain. So I am still in a bit of shock at the moment with what's actually happening. So I'm going along with the next step.
No, fantastic. Thank you so much. Now, you've got a very interesting sort of story, really, haven't you, about sort of what happened to you. Would you mind just sharing that?
Oh, the beginning or right at the end?
Yeah, absolutely. So
well,
the accident.
I used to be a personal trainer for years, years and years, and I became a free runner, parkour or free running, basically jumping off buildings or things like that. Might sound a bit extreme, but that's what it was. And I basically jumped from a building to get to the other building, but I missed. I fell through a greenhouse, knee first, hit the ground, concrete ground, and my knee exploded, basically. My one patella went that way, the other went the other way. So I haven't been able to walk, or I was in a wheelchair and on crutches for 8 years. 8 years. And between that, 2 years after this accident, I got cancer, which limited me from bending, as I've got a cut across my stomach, and it's limited from bending, and nerve damage and a few other things. But I've kept myself going all the way up until when I met Surinder. I've been in pain ever since. I've been to hospitals for the pain, been given tablets and things. I've had to try and self-care for myself all the way to where I am now, being in pain. So basically this last week, I don't know what to say. This last week, I've said I've been in pain for 8 years, every single day, constant waking up with pain. But this last week or so, I haven't had the pains I've been having for 8 years. I don't know what else to say. I'm in shock, basically, because I'm not feeling the pain. And as I go home today, like yesterday, I wasn't feeling the pain that I've been feeling for all them years. It's just slight pain. And I haven't had slight pain for years. I've just had pain, constant pain that I have to try and adapt to and, you know, just get through life with. But like, this is changing my life, and I don't know how far this is going, but I've got the dream of walking again. You know, that's what my aims are. And just painless, just simple little pains that we can all handle is what I'm looking for. Not the pain I've been going through for the years. And I feel so much better in myself today than I was yesterday, and the day before, and the day before that, and the day before that. It's just, the more I come here, it's getting better and better for me. That's basically how I can go with this. It's just, every time I come here, I feel good in myself. I can get more things done because I'm limited to everything I do, but it pushes me and gives me that more I can do it factor. You know, that's where I'm at.
Thank you so much. Thank you for sharing.
Oh, that's fine. That's really fine.
Hi, Dr. Sandhu from Bedford Chiropractic Clinic. Today I want to talk to you about sort of shoulders. All right, so let me just more on. So shoulders. Now shoulders are very complicated joints because of the mobility that we have to have in them, because obviously the movement that it allows us to have. Now, what we can have here is we can have sort of a common one is called rotator cuff. So rotator cuff is an injury where there's 5 muscles, they're called the sits muscles. I won't go through all the names of them, but there's 5 of them, and they all attach sort of around the shoulder, and what they do is they give the shoulder stability and allow sort of movement, this internal, external rotation movement, and also sort of abduction and adduction movement as well, which means up and down. And what can happen is that because of an injury, and now that injury can be directly to the shoulder, where you get sort of a push, or you get a hit, or you get some kind of sort of, you try and push something, and you're forcing something, so you get like a sprain strain. That can create sort of then tension in one or all of those 5 muscles. And that will then give you sort of an ache, a general ache around the shoulder. It can also reduce the movement in the shoulder as well, and it can also give you radiating pain going up into the neck and also into the back in here and down into sort of your upper thoracics. Now, one of the things you have to understand is that shoulder problems are not necessarily shoulder problems per se, because as we can sort of see from the spine, the neck part here, the 7 joints, are where the nerves actually run down into the shoulder as well. So yes, absolutely, the shoulder may need treatment directly, but one of the most important things, and as a chiropractor, and especially here at Bedford Chiropractic Clinic, what we do is we look at the whole biomechanical chain. So we check out the neck, we check out the shoulder, we check out the elbow, because elbows can also give shoulder a discomfort and pain as well. So if you think you've got rotator cuff, make your way here to Bedford Chiropractic Clinic and let us help you get out of pain and discomfort. Dr. Sandhu, Bedford Chiropractic Clinic, we're here to help.
I'm Barbara. I'm here on recommendation from my daughter. I've got problems with my shoulders. I've had terrible times trying to do anything whatsoever. Even doing my hair, cleaning my teeth has been very, very painful. Since coming here, I'm going to cry. I can't do it. It's been so much better. I can move my arms, which I couldn't do before. Oh dear. But obviously I didn't think this was going to work as well as it has, and it's such a short space of time. So I'm very grateful for everything that Surinder's done for me and continuing to do for me for the future health of me. I can't.
Hi, my name is Jill and I've been coming to the Bedford Chiropractic Clinic since August 2010. I first came because I was hardly able to move with lower back pain and thought it was related to my left hip. I came and I had a very thorough assessment by Chanel and was very interested in the diagnosis that it wasn't my hip, it was my lower back. I, from there, had my initial session with Surin and immediately felt a lot of benefit. I had to come initially 3 times a week, but improved each time I came, and I am now coming once a fortnight to maintain my mobility and to deal with any problems as they arise. And I can fully recommend all the staff here at Bedford Chiropractic Clinic. I don't know where I'd have been without them.
Okay. Hello, my name is Ian Erskine. I came originally because I had problems with pains in my lower back. We've largely eliminated those, but additionally I have had an operation about 6 years ago for a persistent dislocation of my left shoulder, which left me with very much a constricted amount of movement. I couldn't do that for a start, and I certainly didn't have the movement that I currently have, and that's all down to the Bedford Chiropractic Clinic. And I'm most pleased.
Hi, and welcome to Bedford Chiropractic Clinic. Dr Sandhu here, and today we've got the lovely Jane here with us. So Jane, you came initially to me because you had some shoulder problems, because one of the things you do is that you're a hairdresser. Yeah. So could you just explain a little bit about sort of what initially brought you here then?
Well, basically I'm stretched in bed and I had this agonising pain, and after 3 weeks it just wouldn't go away.
Okay.
Doctors just prescribed painkillers, and really that was just not helping at all.
Mm-hmm. And then sort of what happened? What made you sort of come to us?
I sat in tears. I just couldn't get rid of the pain.
Mm-hmm.
So I went onto Google, and I looked for a chiropractor,
right.
And I looked at your reviews and your Facebook site.
Brilliant.
So I thought, well, I'll give it a go because I was in so much pain. And you kindly offered to see me that day. I think you could hear how much pain I was in.
Yes, that's right. And how are you feeling now?
Wonderful.
Okay, good. So how is it actually sort of, what sort of difference has it made to you?
I've no pain at all. I can do everything now. It doesn't stop me doing anything. When I'm getting dressed, there's no clicking or aching, or I just feel taller. Everything's better.
Fantastic. Thank you very much. So you're glad you came?
Yes.
Great. So what would you like to say to the people out there, especially the hairdressers out there? What would you like to say to them?
I think you don't realise the wear and tear on your arms when they're in this position all day. I just stretched and something went. I don't know why, but I guess it is just the wear and tear, and I don't think you realise it catching up with you. But what I found was that other things weren't in position, which had a knock-on effect. And I would say definitely look after your spine, because it's made me realise how important it is.
Great. Jane, thank you very much indeed. So, Bedford Chiropractic Clinic, Dr Sandhu here, we're here to help.
My name's Roy Folks.
I came to the clinic because I had a severe pain in my shoulders and I hadn't slept for at least 5 months. After the first treatment, I have slept a solid night for the first time.
Hi, Dr Sandhu from Bedford Chiropractic Clinic, here with Steve, our Bedford Chiropractic Clinic skeleton. Today we're going to have a look at sort of elbow sprain and strain. Now, elbow is quite sort of a simple joint, but complicated at the same time. You have these two bones, sort of the ulnar and the radius bone. You have the radius, which is the big bone here, and the ulnar, which sort of lies next to it, and they basically then go on and form the wrist. And you can get sort of an elbow sprain strain. Now that can happen very, very simply from basically you trying to lift something and turning your wrist and arm in the wrong way. It can be through a fall. It can also be through repetitive sort of problems as well, like sort of a tennis elbow and golfer's elbow. Watch the other video on golfers and tennis elbow where I explain those in a little bit more detail. So the sprain strain can cause sort of just a localized pain in the elbow. It can give you sort of discomfort sort of down your arm, into your wrist, into your hand. It can also cause a problem here in the shoulder as well, because obviously it connects to both. It connects to both. So it's really important to get everything checked. And here at Bedford Chiropractic Clinic, we're going to check the whole arm, we're going to check the whole biomechanical chain, but also most importantly, we're going to be checking your neck and your spine as well. Because remember, sort of the nerves from your neck supply the muscles all the way into your fingers. So if there is a problem in anything in your arm or your wrist or your hand, it could well be that it's coming from the neck. So we will check your neck, we'll check sort of the nerve supply, we'll check the joints out, make sure that the joints and the muscles are working well for you, right? And we'll try and work out the real reason why that pain is with you, why that discomfort is with you. Because here at Bedford Chiropractic Clinic, we're more interested in the real reason rather than just treating your symptoms. Because remember, prevention is always better than the cure, but you've got to deal with the actual problem. So give us a call at Bedford Chiropractic Clinic. Let us help you today. What I want to do today in this very, very short video is I want to talk to you about badminton and some of the problems that you as badminton players might be experiencing. Now, the most common ones are sort of wrist problems, elbow problems and shoulder problems, and of course a lot of that is to do with sort of the repetitive sort of strokes and of course the very fast speed of the game, and of course not using those muscles unless you use them sort of once a week or twice a week or whatever. So what we here at Bedford Chiropractic Clinic can do for you is we will examine you very, very carefully, and don't be surprised if I tell you that the problem is in the neck, and you might be experiencing the symptoms in your arm or your shoulder, but it actually could be originating from the neck, because that is where the nerve supply to those muscles are. And if the nerve is jammed up here in the neck, then obviously that muscle is not going to be working. And if you continue to play, you're going to get inflammation, you're going to get tendinitis, and that's going to just give you more pain. So here at Bedford Chiropractic Clinic, we will examine you very carefully, we'll find the cause of your problem, and we'll help you get back onto that court again and playing at your best. So, looking forward to welcoming you. Hi there. Okay, so before you go, right, don't forget, over here is our details on how to call us. So our phone number is there, and absolutely subscribe to our channel and follow us on all the social media, Facebook, Twitter, Instagram, and I look forward to seeing you soon. And here with Steve, our Bedford Chiropractic Clinic Spine. What we're going to do today is we're going to have a look at sort of elbow problems. Now, a couple of the most common sort of elbow problems that we get are tennis elbow and golfer's elbow. Now, tennis and golfer's elbow affect sort of the inside and the outside of the elbow. Now, as you can see from here, there's two bones. You have sort of the radius, which is this big bone here, and you've got sort of the ulnar, this little bone that runs down the side in here and then joins up with the wrist. So what you can get is you can get the tennis elbow, which is very common, which is this sort of irritating, this inflamed, this pain, the localized pain, which can radiate into the hands, radiate up into the shoulder. It can be very, very sort of strong. It can be painful to the touch. It can be painful on movement, on flexion and extension of the wrist. So moving the wrist backwards and forwards like that. Also, if you grip something, it can reduce the grip strength. And it's very common. You don't have to play tennis to get it. It is a repetitive strain injury. So what that means is you're constantly overusing that muscle. Because what you have here is you have this muscle that runs all the way up in here and then forms a tendon that attaches into the upper bone here, or of the humerus, the condyle of the humerus here. And that sort of can get irritated and inflamed. So it's a bit of tendinitis. It is ultimately tendinitis of that muscle right there. And that can be sort of something which can stay with you for a long time, because tendinitis can take a long time to heal. And obviously, if you keep working or typing, working with your mouse, are unfortunately the most common things that we do these days, and that can aggravate it. A golfer's elbow is just on the other side of the elbow. It's sort of inflammation and aggravation again of the tendon here that attaches on the inside of your arm. And that can also be sort of because of overuse as well. It's normally because of overuse. It can also be that when, as a golfer, when you're hitting that divot and you sort of hit the ground and you get that vibration into that elbow. And obviously if you keep doing that sort of over the course of the 4 hours that you're walking around the golf course, that can give you that tendinitis and can aggravate and give you pain and discomfort as well. So what we will do here at Bedford Chiropractic Clinic is we will be checking obviously the elbow. We'll be sort of helping to sort of make sure that there is no sort of sprain or strain of the elbow which could be causing it. We'll also be checking the wrist as well, checking all those bones in the wrist, and also checking your shoulder. And of course, importantly, we'll be checking your spine, because your nerves that originate from the neck here are really, really important, because the nerves here could be causing a muscle weakness in your forearm, in your upper arm, which can then obviously mean that when you're continuously using that muscle, the muscle isn't working effectively. Because remember that muscles are just pieces of meat. They only work if the nerve from the brain, which is located here in your skull and in this spine, actually communicates and tells the muscle to do something, to contract or to relax. And if that message doesn't get to the muscle doesn't work. So here at Bedford Chiropractic Clinic, we're here to find the real reason for why you're getting that problem, right? And actually to help you to get quicker relief and get you better. So come, give us a call today. Take care now. Okay. Hi, and welcome to Bedford Chiropractic Clinic. Dr. Sandhu here, and today we've got the lovely Jane here with us. So Jane, you came initially to me because you had some shoulder problems, because one of the things you do is that you're a hairdresser. Yeah. So could you just explain a little bit about sort of what initially brought you here then?
Well, basically I stretched in bed and I had this agonising pain, and after 3 weeks it just wouldn't go away. Okay. Doctors just prescribed painkillers, and really that was just not helping at all.
Mm-hmm. And then sort of what happened? What made you sort of come to us?
I sat in tears. I just couldn't get rid of the pain. So I went onto Google, and I looked for a chiropractor, and I looked at your reviews and your Facebook site. So I thought, well, I'll give it a go, because I was in so much pain. And you kindly offered to see me that day, because I think you could hear how much pain I was in.
Yes, that's right. And how are you feeling now?
Wonderful.
Okay, good. So how is it actually sort of, what sort of difference has it made to you?
I've no pain at all. I can do everything now. It doesn't stop me doing anything. When I'm getting dressed, there's no clicking or aching, or I just feel taller. Everything's better.
Fantastic. Thank you very much. So you're glad you came?
Yes.
Great. So what would you like to say to the people out there, especially the hairdressers out there? What would you like to say to them?
I think you don't realise the wear and tear on your arms when they're in this position all day. I just stretched and something went. I don't know why, but I guess it is just the wear and tear, and I don't think you realise it catching up with you. But what I found was that other things weren't in position, which had a knock-on effect. And I would say definitely look after your spine, because it's made me realise how important it is.
Great. Jane, thank you very much indeed. So Bedford Chiropractic Clinic, Dr. Sandhu here, we're here to help. But some of us have been in that state where it's sort of been that constant, horrible nagging pain that runs all the way down the back of the leg into the foot. It can be numbing, it can be tingling, pins and needles, it can create limps. But most importantly, what it does is, apart from that horrible pain, is it can stop you from doing the things that you want to do. You know, from being able to go to work, from being able to pick your children up, from being able to sit and eat with the family, from being able to go out for the evening, being able to just sit comfortably. And all of these things are things that some of us will just put up with and hope that painkillers will resolve. Well, painkillers, all they're designed to do is dull the brain so that you don't feel the pain. But they're not there to actually solve the problem. What we here at Bedford Chiropractic Clinic do is we actually look for the problem. We look for why the back pain is there, right? Because that's important. Because if we can find the reason for why the back pain is there, and it could be lots of reasons. It could be because of problems here in your spine. It could be because of problems here in the muscles, or in the muscles in here. It could even be related to your neck or down to your feet. But we're here to find that reason. And once we find that reason, we can then help you to resolve it. We can help you to resolve it with the right treatment, with the right sort of adjustments, with the right advice, so that you can get your life back. Because at the end of the day, what is life without health? So Bedford Chiropractic Clinic, we're here to help you get your life back. Hi there. Okay, so before you go, right, don't forget, over here is our details on how to call us. So our phone number is there, and absolutely subscribe to our channel and follow us on all the social media, Facebook, Twitter, Instagram, and I look forward to seeing you soon.
Dr Sandhu at Bedford Chiropractic Clinic, and just like to give an update on how much I've benefited from treatment within this practice. 2 injuries, one when I was 17 on the base of my back, the coccyx, a second injury just in the small of my back, and one between my shoulders, all before I was 20. I had injections, I had physiotherapy, I had chiropractor work done. I'm now 68, so that was 49 years ago or thereabouts. And during that period I have suffered unmercifully and still worked fully, continued through, but could not find anybody who I felt could give me any assistance, any help, until my daughter came to this practice for similar needs with her back and invited me to come along with her, and one session with these fine people here and I could see the instant improvement. I'm now probably 4 months down the line. The last session that brought me in, I was getting shooting pains up and down the back, and I honestly thought I was going to end up hospitalised this time. Came in, and now, very short space of time, the job has worked, and I am now feeling the best, 50 years on basically, that I've ever felt. I do the exercises that I'm told will help, and I definitely can feel that they do assist and help. So it's not just about what work that is done on the day, it's the ongoing that is required, and that is why I have faith, because these people have told me honestly from the start, and their work has proved it. One satisfied person. Please don't hesitate if you have issues similar to me. Thank you.
Hey there. So for many years I've had awful back pain. I was struggling to even get out of bed in the morning. What to speak of walking around and sitting for prolonged periods. So I finally decided to come and see Bedford Chiropractic Clinic with Dr Sandhu. I can honestly say it just changed my life. Like, I can't tell you emphasize how much it feels so good to be pain-free and have my mobility back. I understand they've got an amazing offer coming up, so I'd really suggest if you've got any lower back pain or any pains within your body, you come and check them out. Thanks a lot.
I've been having back pains, back issues for a good few months now. Went to Bed's chiropractor, and trust me, it helped me a lot. Dr Sandhu's been really good, and they've got an offer coming up, so definitely go and check that out.
Hi, my name's Steph. I'm a qualified nurse. I've been suffering from back pain, neck pain and sciatica down my leg for many years now. I finally got it in me to come to the chiropractor, and it's the best decision I've ever made. I was living in a back brace, which I now no longer wear at all, and I'm so less reliant on all the painkillers that the GP gave me. And I couldn't recommend more. If you've got any pain at all, come see the doctor. Best decision I've ever made.
Hi, my name's Tom. I recently pulled my back out really bad at the gym. I had to go to Bedford Hospital for an ultrasound. The pain was unbearable. I was on crutches. They gave me a load of painkillers, three lots, and came home and the pain was still awful. I still having to use the crutches. I called Surinder. He was back from his holiday at the time. Came into his practice. Within 10 minutes I was up, walking around with no pain at all. Brought my little sister for the first time. She was amazed, and couldn't recommend this guy enough. And I know they've got a special offer at the moment, so definitely check him out if you're interested. Could not recommend him enough. Cheers, guys.
Hello, I'm Simon. I train and compete as a triathlete. I first came here last October with a back muscle spasm. I was in quite a lot of pain and discomfort. Through working here, I've been able to work out some imbalances and strengthen my whole lower body, really, well, my whole body. And my last race last weekend, I did half an hour quicker than last year before starting with Bedford Chiropractic Clinic. I thoroughly recommend them for all your ailments.
Today in this short video I want to talk to you about hips. Now unfortunately you will know somebody, or you may actually be experiencing this at the moment, so people with hip pain. It is unfortunately very, very common. It is a major operation that is become unfortunately just an everyday occurrence these days. Hip is a major joint, it's a weight bearing joint. If we have a look on our little skeleton here, you can see that sort of you have the pelvis and the hip joint then attaches into there. And then of course you have the knee and the foot. Now hip problems are caused primarily, so unless of course there's been some physical trauma to the hip itself, primarily by what is happening in the foot. Because if the foot is not sort of working properly, then that's going to be putting a strain on the knee, which is then going to be putting a strain on the hip. And if the hip then is under strain over time, because the body has an incredible ability to cope, you will get wear and tear in that joint. And that wear and tear then can lead to sort of that dull ache. Now the ache can be necessarily not always over the hip joint, it can be in the groin, it can be in the back, it can actually be also running down the side of the thigh as well. And this is in particular a muscle called iliotibial band, ITB band. Iliotibial band that connects down to the knee, so that can give knee pain as well. They can also sort of be related to what is known as a bursa. A bursa is a fatty sort of fluid tissue. It's like a pouch, and that sort of sits in between a bone and a ligament or a tendon, and it sort of gives you that sort of gives the joint some friction. It sort of reduces friction, allows it to just to sort of work well, and sometimes that can get inflamed, it can get sort of aggravated, angry, and of course that then can also give you hip pain as well. Here at Bedford Chiropractic Clinic, after we've done a consultation with you, taken the case history from you, we will examine your hip very, very carefully. Not only the hip, but we'll examine the knee and the foot and your back, because we are here interested in looking at the cause of your problem rather than just what the symptoms. Because at the end of the day, the hip pain may not only be coming from the hip, it may be coming from somewhere else. And we want to find out and help you get out of the pain. So here at Bedford Chiropractic Clinic, we're here to help. Give us a call today. Hi, welcome to Bedford Chiropractic Clinic. Dr. Sandhu here. Today in this short video I want to talk to you about knee problems. Now, knee problems are very, very common, and unfortunately there's a very large population out there who will go on to have knee arthritis, wear and tear, to have knee problems, and eventually, unfortunately, will have to have a knee replacement. Now the thing is that doesn't have to be the case. Right? Surgery is always the last option. What we can do here at Bedford Chiropractic Clinic is find out the reason why you're getting the knee pain, right? Because there's always a reason. And as long as sort of an MRI scan or an X-ray has shown that there is no sort of physical damage within the knee itself, then there is perhaps something that we can do to help. One of the main problems that that cause knee problems are your feet. So you've got to look at the feet first, because the position of the foot, how you sort of put weight on the foot, can control what happens to the knee. So we start by looking at your feet, and then we look at the knee. Now the knee is a very simple structure. What you have here is you have sort of like a hinge joint here, and you just have the big bone up there that comes from the top of your thigh here, and then you have sort of the big bone here that forms a shin, and a little bone that sort of runs down the side. Inside you have the meniscus, and then you have the various ligaments in there. So by very close examination of those joints, of those muscles and those ligaments, we can generally identify where the problem is. And that may mean that by resolving it sort of sooner, you may not need that surgery or that operation. So before you perhaps think about that or go that way or leave it until it gets to that stage, why not come to Bedford Chiropractic Clinic, where we can help you resolve and hopefully sort of stop any kind of knee problems that you may have. So Bedford Chiropractic Clinic, give us a call today. Good evening, Bedford Chiropractic Clinic, Dr. Sandhu here again, and today we've got lovely Bronwyn, and Bronwyn is going to just tell us a little bit about sort of what brought her here today.
Okay, well the reason I came is because I've had a terrible problem with my knees for many years. I've got arthritis in the knees, and the only thing my doctor recommended was, well, I could take up to 12 paracetamol a day, and I didn't think that was a good thing.
No, and I don't blame you. And then, what has been your experience since coming here?
Well, since coming, I'm definitely feeling much freer. I'm walking so much better. All my friends have remarked on it. I'm not in as much pain with my knees, and I can do a long walk and I don't get after effects. And I actually can pull myself off the ground now. Before, I didn't have the strength in my legs to do that. So, really making improvements.
Fantastic. So what would you say to the people out there who are sort of struggling and suffering with sort of knees or any other kind of joint problems?
Don't do that. Make a appointment with you.
Fantastic. Thank you very much, Bronwyn. Dr. Sandhu, thanking you all and looking forward to seeing you and helping you. In this short video today, I want to talk to you about sort of Achilles and plantar fasciitis and just general sort of foot biomechanics as well. The foot is an incredible joint. It has 26 joints, 107 ligaments, 19 tendons, 20 muscles. There's an amazing amount of stuff that can go wrong with the foot. Now, in an ideal world, we should have a foot that has 3 big arches in there, transverse, longitudinal, and a transverse arch that basically gives us a shock absorber, which allows us to sort of position the foot in the right place, but also make sure that the knee is in the right place as well. And by doing that, you have very relaxed muscles in your calves and in your hamstrings, but also in your hip, and that has a direct effect onto your back and into your neck. Professor Rothbert, a foot specialist, actually took some x-rays of people standing on barefoot. He then x-rayed their neck. He re-x-rayed the neck, changed the foot position, and the bones in the neck moved. The bones in the foot have a knock-on effect onto the neck. They affect everything in between. Now, patella is a muscle that sort of is formed as the calf muscle comes down here and then attaches into the back of the heel here, and it's called the patella. It's a tendon. Now unfortunately, if the foot is not working properly, can you see how the ankle is going to be affected at the angle that it's going to hit the ground? So if the foot is not working properly, that is going to be having a knock-on effect onto the calf muscle, which is then going to aggravate and irritate the patella along here, and you can get something called patellar tendonitis. So it's not enough to just stretch and massage the calf and to work on the tendon. You have to look at the function of the foot. You have to make sure that the foot is working properly. So here at Bedford Chiropractic Clinic, we will be looking at the whole function of the foot to help you get rid of that patellar tendonitis that you may have. The other big problem that we can have in the foot is something called plantar fasciitis. Now plantar fasciitis is this horrible sort of pain which is normally felt here at the base towards the back of the heel of the plantar part of the foot. And every time you stand up, especially in the mornings, when you get up in the mornings, it's very, very painful. When you've been sitting for a while and you get up and try and walk, again, it's very painful. Now, there is a reason for that, and the reason for that, again, comes to the biomechanics of the foot. If the foot has lost those arches, which unfortunately, in my experience over 19 years, 90% of people are flat-footed. They're pronating. That means then that this muscle, this fascia, that attaches from the heel all the way into your toes here, right, is stretched taut. So it's like sort of a very, very tight piece of cling film. And that then is being stretched out like this. It attaches to just at the base of the calcaneus here, and as with every step you take, it pulls, and you get this aggravated, inflamed, red, angry, painful spot here, and that's plantar fasciitis. Again, the way to treat that is to look at the biomechanics of the foot to make sure that the foot is working properly, and then obviously by correcting that, you're going to get rid of the pain. Here at Bedford Chiropractic Clinic, we are very, very geared towards looking at the reason that you are having these symptoms. And by treating the cause of these problems, we know that your problems will disappear and we can help you. So give us a call today, let's find out the cause, and let's help you.
Hi, I'm Gemma Grayson. I came to the clinic because I was suffering from just back pain and neck pain and knee pain, from general sort of things, just from day-to-day stuff, from neck, and had a couple of car accidents as well, so the neck was particularly stiff. So I came along in the hope that, that these guys would be able to help me out, and they certainly have. I feel so much better. I've had, I think, about 9 sessions now, 10 sessions, and the improvement has been incredible. So I highly recommend them. They're absolutely brilliant.
What did you come in with? What were the things that were happening with you?
I had numbness in my legs and my feet, and severe pain in my back.
Okay. And when you sort of came here yesterday, you walked from the bus station and you found that you were shuffling all the way here.
As I have been for a number of weeks, just to shuffle.
Yeah.
But when I left here, I strode. I took strides down to the bus station.
Fantastic. Good. That must have felt nice to be able to stride again.
It did. I saw this where you were talking about, but that's to be expected. But the fact was that I was able to stride and not shuffle.
Brilliant.
Like an old man, although I am 73, come on 74.
Yeah.
But I look at other men older than me that are striding out.
Absolutely.
I think why not me?
Absolutely, because age should never be a barrier to you being able to do what you need to do. But the reason that you're not able to do what you need to do is because there's something wrong with the body. There's some muscles that are tight, there's some joints that are tight. But once we find that out and we deal with it, then you can stride again. And the other thing, of course, was this morning, did you wake up? Well, firstly, how did you sleep?
The first time, for a long time, I slept all night.
Wow, that must be nice.
I fall asleep through the day at various times, And I go to bed at night at 10 o'clock, and by 12 o'clock I'm awake, I'm tossing and turning. I have to get up, I have a cup of tea, look at the television, go back, toss and turn. But for some reason, yesterday I went to bed and I didn't feel tired, and I thought, oh, this is going to be the same thing. But I fell asleep and I woke up at nearly 9 o'clock this morning. Wow. And I really had to rush to get ready to come and finish the appointment.
Fantastic.
I was totally amazed, and I could feel in myself I slept deep.
Brilliant.
Because I still felt the, so I wanted to stay there for a while longer.
Fantastic. And that's the beauty of it, because with the right chiropractic treatment, once we get the adjustments, we get the joints moving, we get the muscles relaxed, the nervous system relaxes, because at the moment when it's in pain, it's under stress, and that's going to give you sleepless nights. It's going to give you sort of pain. And of course, this morning you didn't have pain, you just had some soreness.
Soreness.
But not pain.
It wasn't pain. Yeah. And I could tell it was a soreness. Because I always sort of differentiate, with pain. I'm sometimes asked at different occasions I had to go into hospital, what is the pain? But I say, what is pain? A lot of times it's a discomfort. And pain, I think you know when you're in pain.
Of course you do. Of course you do. Now, the beautiful thing is that it doesn't matter your age. It really doesn't. Right now, chiropractic can absolutely help. Right? But you need to come in and give me the opportunity to see what it is that was causing your discomfort, causing you to shuffle, causing you not to be able to sort of sleep well at night, causing you to not be able to sit for any length of time, not be able to do the things you want to do. Right? And I really want to help. That's my goal. So, Robert, thank you so much. So what would you say to the people out there who are shuffling around in pain and basically just living a life where they're just not doing what they can do?
The only thing I can say that over the years I've had reason to go to many a chiropractor. I've tried physio, and quite frankly I haven't got any time for them. But chiropractors have always come up trumps and done the job that they say they're going to do.
Excellent, thank you so much. So, Surinder Sandhu, Dr. Chiropractic, Robert, thank you so much. So, age is not a barrier, do not be in pain. Come and see us, let's see what we can do. Check us out on Facebook, Instagram, and also check out our YouTube videos, and let's help you today. Thank you.
I'm Lorraine, and this is my son Elijah.
Well, I'm Cipriano. So what brought us here was my mum was really in pain, weren't you?
Yes.
And she used to have pain relief, but now she goes so fast.
I do. I spent quite a long time taking tablets for my pain that I had in my lower back. I've also got arthritis in my knee and my feet, and unfortunately had to give up exercise that I really enjoyed. And since I've been coming to see Dr. Sandhu, I've noticed a huge improvement in my health and well-being, to the point where recently we were on holiday, and running is something that I've not been able to do for a very, very long time. And I challenged Elijah to a jog, and much to my surprise, I was actually able to run for a lot longer and further than I'd ever done before.
Well, last time he was slower when he didn't see Dr. Sandhu, but now when he's been really fixed, he has been running a lot, and he was actually quite faster than me.
Wow, that's amazing.
So for me, it's been an absolute turnaround. I'm doing things I never thought I'd be able to do again, and part of the journey for me is that I'll be able to dance again. So I know that if I'm able to run, then I'm definitely on the way to being able to dance.
Absolutely, absolutely. Thank you very, very much. So what would you say to sort of people out there, mothers out there, fathers out there who are suffering?
I would say that you don't have to live with the pain, you don't have to live with limitations. Come and see Dr. Sandhu and get yourself sorted, get your body where you want it to be. There are no limits. What would you say, Nigel?
I would say just have a go, but if it gets any worse, just see your own chiropractor, because see it. Don't live in the pain. No.
Thank you so much. And Elijah, wise words. Thank you very much, both of you.
Thank you.
I'm at Bedford Chiropractic Clinic. My name's Dean. I've had a lot of problems with my lower back due to an accident falling over while roller skating, and since coming here I've not been waking up in pain, as that I have been doing for the past 8 years, and I feel so much better with my life now, the way everything is going and how much more I'm able to do now.
Perfect, Dean. And what would you say to patients out there that don't know anything about our clinic?
I would say get yourself down here as quickly as possible if you are suffering from any back pain, any shoulder pain, or just any pain to do with nerves, and help yourself get sorted.
Thank you.
Amazing is the first word that comes to mind. I have visited many chiropractors in multiple countries, and not one has diagnosed me, prescribed the right manipulation, the right way to treat my issues, and explained it in such detail as Dr. Surinder. Now, I've spoken at chiropractic conferences all over the world, Parker, Cleveland, all of the different clinics where they've trained hundreds of different chiropractors, and nobody has come close to the value, the way that Dr. Surinder has treated me. I feel better. I know what I need to do in order to feel better going forward. It's not just the one-time adjustment. It's multiple ways of handling my health, managing my health. It's my body, not anyone else's. It's my body. And I want to manage my body to the best of my ability, so I've sought out the advice, the direction, the expertise of a professional. Dr. Surinder knows his stuff. I know what I know. He knows what he knows. He was able to share that information with me. The treatment he was able to provide me makes me feel better. Oh my God, I feel lifted right now. My neck feels better, my arm feels better, my knee feels better, my hips feel better. All of that is an improvement directly resulting from his diagnosis, his prescription, and the way he treated me. Thank you, Dr. Surinder.
Thank you so much.
Hi, my name is Gemma. I did a speed decathlon at the weekend, which is where you do all 10 events within an hour, where you have to start the 1500 within an hour of doing the 100. I've been having treatment for quite a while now, and this is one of the first times I've been able to do from hurdles to 400 to 1500 to pole vault to discus with hardly any pain at all, apart from the pain of actually running the 400 metres. Yeah, legs were fine. I've been struggling with my Achilles, didn't feel anything there. I've had a problem in my neck from throwing, and again, that was all fine. So I'd like to say thank you very much to everyone at Bedford Chiropractic for helping me out.
my name's Nick. I'm 34. I've been having back issues for numerous amount of years, but recently, the last, I would say, 2 months, the pain has been excruciating in my lower back. So much so where I've been hunched over, I haven't been able to walk, even sitting down was causing me issues. I've been to sort of conventional osteopaths where I thought that was the answer, where I was having my back manipulated, cracked, I was having acupuncture done, even so much so to having sports massages just to try and release the tight muscles that I thought that I had formed around my back. Up until 2 weeks ago when I came to see you guys here, so much so that I was unable to walk. I was holding on to my fiance to help bring me up the stairs, to get me out of the car. Numerous amount of sessions that I've had with you guys where you've helped manipulated my back, you've cracked it, you've given me exercises to do, to a point where within a week I was actually able to stand upright and actually walk on my own unaided. There's still a long way to go, but the recovery's been absolutely amazing. I get married next week and I didn't think I'd be standing here at this point now. I would say painless as we are at the minute. So I'm just looking forward to the rest of the recovery and what else comes with it.
Sandhu here from Bedford Chiropractic Clinic. Now today, last week we put in a video of Christina out there for you to watch, and she gave us a wonderful sort of testimonial, but also her background of how she'd been in pain for so long and nothing was being done for her. Well, what I want to show you is I want to show you the other side of every patient that comes here, and that's the person who gives them the support and has to put up with seeing them in pain and obviously sort of dealing with that. So Adrian is Christina's husband. So Adrian, so you've seen her now. This is what, the third treatment that we've done now?
Yes.
So what are your feelings?
I feel it's going to work.
Yeah.
Much better now.
Good.
Much
How's
better.
Kristen been now?
No, much better. She improved. She's walking. She improved. She's a little bit of pain, not so bad like at the beginning.
Yeah. And she's smiling as well.
Yeah. He started smiling.
Yeah. Which is nice.
It's very nice.
How long has she been in pain?
About a year.
About a year.
A year.
Yeah.
A year.
Yeah, and it's very sad to see someone you love in pain.
Yeah, for sure.
Yeah, no, absolutely.
Thank you very much.
It's my pleasure. It's my pleasure. Now, we're here to help. Please don't be in pain for 2019. Don't be in pain. Come and let me see if I can help you. And I look forward to helping you.
For sure. Thank you very much.
Thank you. Fantastic. So since 1982, you've been having regular checkups and you're 81 years old.
Yeah.
Okay. Would you like to just bend forward for me, please, John? Just
touch
bend
your
forward,
toes.
please. Touch your toes. Okay. 81 years old. Okay. Stand up for me and just face this way so people can see you. So that way.
Yeah.
And I want them to see you from the side. I just want you to bend backwards now as far as you can. Okay. No discomfort.
No.
Fantastic. And now I just want you to just keep your feet still and twist this way.
Yeah.
And now I want you to twist the other way. And no discomfort at all.
No.
Okay, now we've just had an adjustment today because John comes in regularly for chiropractic care. And I've been having chiropractic care for 25 years. Will continue for the rest of my life because 81 years old, like, I want to be able to do all that without any pain. Clinic, Dr. Sandhu here. Now I'm really happy I've got lovely Greta here with me. Now Greta, you came to the clinic with some issues. There was quite a few things going on. But then one of the main things was about your hand, wasn't it?
Yeah.
So just explain to us what was happening, please.
So my hand was going numb anytime I gripped anything to vacuum or hold a cup of tea or write or drive or anything. It was going completely numb.
Right, okay. And you were beginning to sort of drop things. You were
Yeah,
sort of finding
dropping things, really weak muscles in my hand.
That's fine. Now, when we tested Greta, when we did that first consultation and we did that intensive sort of physical exam, what we found that there was sort of an elbow problem. The elbow was completely weak, and we also found that when we tested your sort of nerve supply, you couldn't hold your thumb and little finger together again. Yeah, and that was obviously what was causing the weakness. Now, what were you diagnosed with? What were they telling you was the problem?
Carpal tunnel syndrome.
Right. Okay. So they were telling you it was carpal tunnel, and what did they want to do?
Steroids and surgery, if that didn't help.
Right, okay. So steroids and surgery, okay.
And a wrist brace.
And a wrist brace as well. Now with carpal tunnel, what they do is they sort of release the transverse ligament that the median nerve sort of goes through in here. And yes, it can help because it relieves the inflammation that may be created in there. But obviously, the median nerve has got a long, tortuous path. It goes down here, through here, up here, down into your arm and up and into your neck. So it could be trapped anywhere. It doesn't always mean that it's trapped there. So one of the things that I do is we check the whole path of the nerve. And what we found in your case was that it was actually around the elbow that the problem was. And now, what are you finding now?
I vacuumed my whole downstairs without any numbness for the first time in well over a year yesterday.
Fantastic. So what would you say to people out there who are sort of suffering with things like this?
Come to Bedford Chiropractic.
Thank you so much. Bedford Chiropractic Clinic. Check us out on our website, thebedfordchiropractor.co.uk. Join our Facebook and Twitter and everything. Follow us. We're here to help you, and I look forward to seeing you soon. Thank you. Hi there, Surinder Sandhu here, Dr Chiropractic from Bedford Chiropractic Clinic. Today we have Pete, Mr. Bedford, back with us today. Now Pete, when you first came, we made this amazing video of you sort of, where I checked you out, examined you, and I mean obviously you came in with a few issues, but you didn't realise how many muscles were not working properly or activating properly.
That's right.
Yeah. So obviously watch out for that video. The video, we'll put a link down below for you to watch the full video of Pete's first examination and first ever experience of chiropractic. So we've given a couple of treatments now.
Mm-hmm.
So just tell me sort of how you've been feeling sort of with the treatments now.
Well, especially with the shoe inserts, it's been unbelievable.
Yes.
You know, I'm using muscles in my legs that you just can't imagine. You know, my hamstrings were firing.
Yes.
I was exercising exactly the same way as I normally do.
Yes.
Every day.
Yes.
And I had the sensation in my hamstrings like I had really worked them. Like I'd done a huge workout in my hamstrings. It was incredible.
Yeah. Yeah, because what was happening with Pete's feet was that because he was pronating, his arches were dropping slightly, his muscles were not engaging as well as they could do. So he had very tight calves, very tight sort of what they call the iliotibial band, glutes, and there were certain muscles that were not firing as well as they could. With the arch supports, obviously they activated.
Yeah.
You're beginning to feel that.
Okay.
But of course, for your sort of your business, your sport, it's really important that every muscle works.
It is.
Yeah, because you have to build that muscle up.
Yes.
So that the judges and the audience can see that.
Mm.
Yeah, no, fantastic. And what else? Because there was also sort of the problem with sort of the arm, the shoulders, and all of that. How's the rest of you feeling?
That's right. Yeah, I was having issues all the way down the left-hand side.
Mm-hmm.
So I've got issues with my chest, my shoulder, bicep, forearm, my hip, my leg isn't firing properly. So,
There was a lot going on.
Yeah.
A lot going on. And how has that been since we've had these last couple of treatments?
It's been a lot better. It's
Fantastic.
been incredible. I mean, the pain in my elbow's gone. I'm just feeling a lot better.
Fantastic. Now you've got a competition coming up in 2.5 weeks.
I have.
So how much more confident are you feeling now?
I'm a lot more confident. It's given me the confidence that I didn't have before. You know, I was concerned before, now I'm not.
Fantastic. And then of course we've got Mr. Bedford coming up again.
Yeah, in October.
Okay. So when is the date for Mr. Bedford?
You put me on the spot.
So it's in October, yeah?
It is, yeah.
Okay, it's
yes,
in October.
it is in October.
So it's the end of October. So guys, you need to come and support Pete, right? Because we want Mr. Bedford to be Pete again.
Mom of 3 kids. I'm here in Dr. Sandhu's clinic for my back pain, which I was suffering for the past 9 years, and the past 2 years it got really worse. And I wasn't able to take my kid to the tuition center in the evening, and it's just 6 treatments into this back pain with Dr. Sandhu, and I felt huge difference yesterday when I was waiting for my kid. He was having his tuition, I was waiting for him there. I was sitting on the same chair there at the cafeteria, and I felt no pain, literally no pain. I was able to do the grocery, and huge pain. So I'm extremely grateful to Dr. Sandhu for that, and I recommend him to everyone, and I want everyone, please do not suffer in pain. Please come get yourself treated here. You will feel immediate results. With very first few treatments, you will feel huge difference. I felt that myself, and I wasn't being able to do any home chores at home, especially after 3 p.m. And everybody knows being a mom is how it's important. We can't take rest. We have to do it anyway. So I want you all to come, please, especially moms. If you have lower back joint pains, hip pain, pelvic pain, do not suffer. Come here, get yourself treated. It's really effective, and I'm feeling huge difference, and I feel like my life is really changed and is changing thanks to Dr. Sandhu.
My name is Peter. I was suffering from terrible back pain in the right shoulder blade. The pain was so bad I went to A&E. They just said it's a muscular spasm, it will cure itself. Well, it didn't, so I then went to the GP. I was told the same. I went back to the GP because there was still no improvement despite taking analgesics and what have you. I was told the same thing again. So in the end, I saw Bedford Chiropractic Clinic. I decided to give it a try, and I cannot believe the difference the treatment has made in just a few weeks. I feel revitalised. I still have pain, but it's not as bad as it was. It's getting considerably better, and the difference it's made to my life just coming here is unbelievable. I would recommend it to anybody. Thank you.